Well, welcome back to Twin Cities Live. You know, when UnitedHealthcare Group saw a real need in the community to address pediatric health disparities, they knew they wanted to find a way to help.
That's right. So that helped lead to the partnership between UnitedHealth Group and Children's Minnesota. They're working with existing communities-based partnerships to help provide health interventions. So here to tell us more about how they're making a difference, we have Dr. Abby Miller. She's the Chief Medical Officer at UnitedHealthcare. Always good to see you. Thanks for being here.
Great to see you. Thanks for having me back.
This is so nice. You guys have, of course, different arms. You know, we mentioned UnitedHealthcare, UnitedHealth Group. There's a foundation involved. So you're all kind of working together. Let's talk about what you saw as a need and then what program came out of it that you're working on.
Yeah. So UnitedHealth Group and UnitedHealth Foundation saw a need to address pediatric health disparities here in Minnesota. One of the things that we recognize is in Minnesota, 1 in 16 kids have asthma. We also know, according to a Minnesota student survey, almost 30% of students report having a long-term mental health condition, things like depression and anxiety. So we really wanted to work on addressing disparities in those areas: asthma, mental health, and vaccinations. And so how this partnership works is, with this grant, Children's of Minnesota is working with existing community organizations. Think YWCA, the Pillsbury community. And with those foundations, they're able to deliver healthcare services directly to kids and their families.
Oh, okay. So could you kind of walk us through a little bit, like, let's just say that I'm a patient, or like I'm the parent of a patient. Like, how does the whole process begin? And are there people in between that kind of help facilitate everything?
Yes. So how this process begins is, so with these existing partnerships, what happens is these kids are able to get services directly through, say, the schools. So Minneapolis and St. Paul Public Schools are some of those existing partners that we work with. So we're able then to deliver healthcare services directly to kids. So think things like asthma care, vaccinations. They're doing mental health screening. They're also doing screening for social needs. And so with some of those screens, they're able then to take that information and connect these families directly to resource navigators. And these resource navigators are helping them then provide some of the additional supports.
I know you have an example, too, of someone who was really helped with this, a 19-year-old single mom. Tell us about her.
Yeah, so the story of Jessica. So Jessica, when she connected with her resource navigator through Community Connect, Jessica was a 19-year-old single mom. Her resource navigator was able to hook her up with some legal aid, who helped her then earn her GED. She actually graduated from St. Kate's University, and Jessica herself is now a resource navigator. So really bringing this full circle.
Oh my gosh.
That's incredible. So how else have you guys seen sort of like the end game outcome? I'm sure when you're going through the process along the way, I mean, every little win feels like we're doing the right thing here, but when you get to the end and you have all these people go through, like, what are some of the takeaways that you guys have seen?
Yeah, so Children's of Minnesota actually reports that we've seen a 29% decrease in asthma disparities among kids at risk. We have seen 54,000 families screened for social needs. Of those, 57% have actually been referred for some additional services through the Community Connect program. So those are just some of the wins that just show you kind of the difference that's being made.
And do you see, I mean, are these disparities happening because, I mean, is it income level? I mean, I'm sure there's a lot of different things that are going into it, but but that's like a significant improvement.
It is. So again, things that we know, so 80% of a person's overall health can be driven by what we call social drivers of health. And so you're exactly right. It's things like where you live, whether you have access to healthy foods, whether you have access to reliable transportation. So the Community Connect program is helping people connect with these resource navigators who are helping them get these services.
I think, too, just in general in Minnesota, sometimes we take for granted just how many screenings you get just across the board. You know, like I talk to friends in other states and it's like their kids aren't getting screened for stuff like we're getting screened for here. And that's important.
It's very important. And again, that's exactly why programs like this are just so key, making sure that we're screening for these things that people are needing. So thinking about, you know, your overall health and again, thinking about our kids being just such an important thing for our future.
Yeah, and speaking of other states, have you guys is this like, are you guys pioneers in this? Are other states sort of like copying? Like how have other states sort of adopted maybe similar programs, and where's that at?
Yeah, that's a really great question, and I'm on it. Honestly, I can't say that I know how this is happening in other states, but we can certainly get back to you about that.
Yeah.
Dr. Miller.
Yeah, well, you
good
guys
stuff.
are crushing it.
Thank you.
Yeah, thanks so
we appreciate
much.
you coming by.
All right, for more health and wellness information, you can visit uhc.com. We posted that link on our website, twincitieslive.com. We'll be right back.